joining us. My name is Jason Cogdell. I'm here with Laura Bibb. We're two members of the ProBenefits compliance team, and on behalf of all ProBenefits staff in North Carolina and beyond, we wish you all the best for a good Wednesday, June the 17th. When we start out at the beginning of every year to design a webinar schedule and series that will hopefully be of advantage and assistance and benefit to our clients, both our employer clients and our advisor clients. We project what may be important during the course of that year, and we also try to be flexible for changes that may happen along the way. And certainly we've learned a lot of lessons as individuals and organizations over the last few months during the pandemic period, but one of those is the best laid plans may not work out the way we want. So what we've tried to do these last couple of months during the pandemic period is adjust our updates, both our email written compliance updates and administrative updates, as well as our webinars, to the specific changes in the law that impact your organization that are going on during the pandemic period. And that is the reason for the session today. COBRA has been important for a long time and is a significant item of federal legislation that applies to most, but not all, employer groups, and is the requirement that those groups must follow a certain set of federal rules relating to continuation of group health coverage. And I'm going to do a quick refresher on COBRA basics in a moment to set the stage and the context for the new COVID-19 deadlines that Laura's going to talk about in more detail and share some examples about. So there's really nothing new about COBRA except these deadline extensions that we will discuss today. So the key, though, the remaining key is that COBRA is of essential importance to employers. In days gone by, some employers could self-administer COBRA. Those days are history, because COBRA is important enough. There's enough risk that employers need assistance doing it and doing it right to avoid risk, to make sure all bases are covered. And that's what we're attempting to do for our COBRA clients. For those of you that we're working with on COBRA, thank you for working with us, and know that we're doing our best on a daily basis, not just our compliance team, but our administrative team, management team, tech team, to assist you with COBRA. So we're going to cover in this time today, we're going to cover some basics and refresher key points about COBRA that we think you, as a member of your organization managing benefits, need to know. We're going to talk about the new changes and our administrative adjustments to those changes, and also your questions are welcome. The best place to share questions is through the question box on the control panel, which we'll answer some of those during the sessions, most of them after the verbal presentation ends, and then also we'll certainly be happy to answer questions by email as well. The big picture context is that the compliance era continues for employee benefit plans. And one way to think about it would be that the compliance era started with the Affordable Care Act in 2010, amazingly a decade ago. It heightened the sense and awareness of the need for compliance and avoidance of risk for organizations, small, medium, and large. And COBRA is the key piece of that. There's been a lot of focus on COBRA the last few years for various reasons I won't get into today, but the result being that COBRA continues to be a big deal, and it's essential that employers do COBRA right. This is something we've shared before, and if you've seen it before, I apologize, but it's something that we like to share as a simple way to think about COBRA, and that's this. COBRA, in its simplest form, is a qualified beneficiary, so an employee who is enrolled in at least one group health plan. That individual is on the group health plan, then they lose group health plan coverage due to a specific triggering event, because all losses of coverage do not trigger COBRA. But there's a loss of coverage due to a specific triggering event, which gives that qualified beneficiary, that employee or former employee, the opportunity to elect coverage for a defined amount of time, and the standard is 18 months, but it can be 29 months or 36 months in limited circumstances, by paying for the coverage. Now, those of you on the session today know that there are a number of misnomers and misconceptions about COBRA. One of them is from employees and individuals is that COBRA costs more than regular group insurance. Of course, that's a misnomer. What employees don't understand is that the employer is subsidizing it when you're an active employee, but when you lose eligibility and become eligible for COBRA, the qualified beneficiary has to pay the full premium, and that's what makes it expensive because the employer's amount, the full premium that's due from the employer to the insurance care for a fully insured plan is a big number and probably bigger than the individual would know. But in its simplest form, this is what COBRA is. Now, it can get complex in certain areas, but this is what COBRA is in its simplest form. So here are the key elements for every employer subject to COBRA, whether that employer has 20, whether that employer has 20,000. The key elements are these. The employer or any data service or representative that's working with the employer to do this has to be diligent about reporting losses of coverage so that any losses of coverage are reported, they're known, and then a decision is made. Is this a COBRA event or not? If so, let's take care of the required notices under the law. There's 7 specific required notices that have to be provided. The general way to do that is by first class United States Postal Service mail. Communication with qualified beneficiaries, letting them know how much they owe, whether coverage is active or inactive, is it enforced, is it terminated? Those types of things are key with COBRA compliance. The premium billing and remittance is a big deal of COBRA. And certainly any questions that come up, any issues that come up about the specific coverage, or in cases where coverage is lost or an appeal is filed, handling the COBRA appeals is a part of COBRA compliance, and all this is part of what we do for our employer clients. Now, as a refresher on who, what, when, and where COBRA happens, first of all, which employers must comply with COBRA. I was on the phone a few minutes ago with an employer in Florida that has 18 employees, had 18 during 2019, still has 18 at this point in the pandemic period. So that is an example of an employer that is not subject to COBRA. That employer could voluntarily, comply with COBRA, but they're not legally required to, because COBRA applies to any employer that had on any typical day during the prior calendar year. So the best way to do it is just think of it as an average during the calendar year 2019, 20 or more total employees. So you would count full or part-time. There's no equivalency to this calculation. Any employer that averaged 20 during 2019 would be subject to COBRA regulations in 2020. Similarly, any employer, even if it used to be 20 or more, that was under 20 for the calendar year 2019 would not be required to follow COBRA in 2020. That employer could voluntarily choose to do so, but would not be legally required to follow COBRA. Now, employers that are smaller than 20 are generally subject to state continuation, which varies by state. Some of those employers choose to follow COBRA, most just follow state continuation. And for purposes of this presentation today, we won't get into the details of state continuation, but that is an important related topic. But I wanted to make sure that everyone understands the exemption. Other than the small plan exemption, the only other relevant exemptions or exceptions are for governmental plans or certain church plans that are exempt from ERISA and then by extension COBRA. There's a star beside governmental plans because for governmental plans, the issue is not just whether COBRA applies, but also whether a separate statute called the Public Health and Safety Act applies, which as a general statement takes the requirements of COBRA and applies them to the federal government and its related entities, as well as state governments and their related entities. So as a general statement, every employer in America is following COBRA unless that employer is under 20 or is an exempt church plan or a specific type of governmental entity for which the Public Health and Safety Act would not apply. Now, once the employer knows that it's subject to COBRA, the next question is, okay, what benefits, what group-related, group-sponsored benefits must we offer COBRA for if someone is in a benefit and then loses eligibility due to termination or another one of the triggering events? The statute defines the eligible COBRA benefits as, quote, group health plans. But it's not just health insurance, although health insurance is primarily what we think about. In addition to health insurance, which, by the way, for health insurance, it would include a fully insured plan or a self-funded health insurance plan that's administered by a TPA or a carrier on behalf of the employer, but also group dental insurance and vision insurance. And one thing some of you as plan administrators know is that traditionally people have elected COBRA more often for dental and vision than they have for medical insurance. And that's a statistic that not everyone knows. As an example, the statistics that has held true for a long time and has not really changed in the era of the Affordable Care Act or COVID is that, generally speaking, about 1 out of every 6 employees that become eligible for COBRA actually elect COBRA. So 5 out of 6 do not take COBRA. And the statistics slightly favor dental and vision COBRA elections over the group medical plan. But it's not just those 3 benefits. Any other group benefit that provides medical treatment is subject to COBRA unless a specific exception applies. Example here, a group cancer plan or a group critical illness or defined illness benefit would be subject to COBRA, except that one of the exceptions is that any fixed indemnity benefit, a hospital indemnity type plan, that once an event occurs, the individual, the qualified beneficiary gets a defined dollar benefit that's not related to the cost of treatment. That's a fixed indemnity benefit. That type of benefit is not subject to COBRA. So that knocks out a lot of the hospital indemnity plans, a lot of the critical illness plans, or even cancer specified benefit plans. But if those cancer plans or critical illness plans pay based on the amount of treatment, not just a defined benefit, then those plans would be subject to COBRA. Prescription drug plans, if they're separate than the major medical plan, are subject to COBRA continuation, as are some health FSAs, not all, because the health FSA has to be underspent by the individual at the time eligibility is lost for the limited COBRA to apply for health FSAs. All health reimbursement arrangements are subject to COBRA with only minor exceptions. So whether that's a deductible reimbursement plan or co-insurance reimbursement plan or an out-of-pocket health reimbursement plan or a medical expense reimbursement plan, all of those benefits are generally subject to COBRA, as well as certain employee assistance programs like telemedicine, certain but not all wellness programs, most on-site clinic type of benefits, or anything else that provides medical treatment and doesn't meet a specific exemption, such as the fixed indemnity exemption, would be subject to COBRA. So what does that leave? Well, benefits not subject to COBRA: life, disability, long-term care, any benefits not sponsored by the employer. So any type of individual supplemental product that the employee can buy and even pay through payroll, but there's no group contract. It's not really a group benefit. It's an individual type of product. HSA bank account contributions, no matter how much the employer is contributing for eligible employees into a HSA bank account, those contributions are not subject to COBRA. That's not a group plan. And dependent care FSAs are non-ERISA and also non-COBRA benefits. This is what the standard COBRA timeline looks like. And I'll share this because when we talk about the COVID changes, we're going to show this timeline again. But this is what the standard COBRA timeline looks like. The items in green on the left, neatly designed to match the leaf on the ProBenefits apple there, indicate that this is a step the plan has to take. As one example at the top, once an individual, an employee enrolls in any group health plan that's eligible for COBRA, that person should get a general rights notice, or some people call this the initial COBRA notice. It's due to be provided from the plan to the participant within 90 days of enrollment, and that generally tells the person what COBRA is all about. This is one of the required notices. Do people read them? Generally not. Do they really matter? Generally not, because once the person loses coverage is really when COBRA matters. But this is one of the legally required notices, so it's on the timeline. It's something that is provided as part of COBRA administration. Then at some point from day one until day fill in the blank, the person is a participant in the plans and COBRA doesn't apply. But when there's a triggering event, a loss of coverage, loss of eligibility, that's a listed triggering event under COBRA, then the COBRA compliance steps kick in. The specific rights notice, also known as the election notice, must be provided by the plan or a third-party administrator on behalf of the plan within 44 days after the triggering event. There's a star or asterisk beside 44 days because technically 44 days results from the combination of the 30 days that the individual has to report the triggering event to the plan, and then the 14 days on top of that the plan has to report to the third-party administrator for the election notice to be sent. So all that matters is 44 days. The standard COBRA election timeline is that once the election notice, the specific rights notice, is sent to the qualified beneficiary, then the qualified beneficiary has 60 days to elect COBRA. Laura's going to talk about how the temporary COVID changes impact that. Then the premium is going to be due, not only for the current month, but all months back to the loss of coverage or eligibility. The premium is generally due 45 days after the election is made. There's a maximum coverage. Some people exhaust. Most people lose COBRA coverage due to non-payment or eligibility for other group coverage within the max period, but the period is 18 months. It can go all the way out to 36 months in limited circumstances, such as a multiple qualifying event, which we won't get into great detail about today, but happy to provide any additional information or training on the COBRA maximum coverage period. And then whenever coverage is terminated, whether after 1 month or after 18 months or after 36 months, there's a notice of termination that goes from the plan to the COBRA participant qualified beneficiary. Now, I've mentioned several times the triggering events. What are the triggering events? By far, the most common triggering event is termination of employment. The second most common triggering event is reduction of hours, going from full-time and eligible to part-time and ineligible in a particular group health plan benefit. A dependent aging out is one of the triggering events that needs to be monitored by the plan, and COBRA needs to be offered to the dependent child once eligibility is lost under the plan, which can vary by benefit when the dependent loses eligibility. Divorce is a triggering event. Legal separation in some states, not all states, is a triggering event because not all states recognize legal separation. As an example, we're in North Carolina. North Carolina doesn't recognize legal separation until the point of divorce as a look-back event. So in North Carolina, the triggering event is divorce, not legal separation. If the employee becomes entitled to Medicare, that's generally not a triggering event for the employee, but it may be for the spouse or dependents if the employee drops the group health plan for Medicare. Death of the employee is a triggering event also. So those are that's a list of triggering events in rough order of how often they apply. And on the next two slides, and I'm not going to go through these individually, are a list of the notices. First, the required notices, which are listed on this slide, and then on the next slide, the notices that are not technically required but are recommended and ones we use as part of our COBRA administrative practices. These slides, along with some others that you'll see when you receive the slides in PDF, are meant just for general education and refresher. While in the interest of time today, I'm going to wrap up the refresher portion of this so we can get into specific discussion of the changes. So this is a slide on required notices. These are recommended. You will recognize some of these that are being used for your plan. For those of you that use us for COBRA administration, we use all of the required and recommended notices. There are some possible notices that are in the not required list that we don't use because they're not helpful to the plan or participants, but these are the optional notices that we use. And final word of refresher, I mentioned this already, the standard duration of the COBRA period without taking into account any of the COVID-19 extensions is 18 months. 18 months is kind of the time frame we think about when we think about COBRA. That's the duration of COBRA, the maximum COBRA period if the qualified beneficiary's triggering event is termination of employment or reduction of hours. So nearly all COBRA max periods are 18 months. However, it can be 36 months if the dependent ages out, which is the most common of the 36-month changes. If the triggering event is divorce, or in some states, legal separation of the employee with another qualified beneficiary, or if the employee enrolls in Medicare, which ends the group health plan coverage of a spouse or dependents. Those are 36 months from the original triggering event date, not an additional 36 months once the event happens. There are additional scenarios of multiple qualifying events. There's also a disability extension that applies when the covered beneficiary becomes disabled under the terms of the Social Security Administration. In the interest of time and importance today, we will not get into those. But as I shift this to Laura to talk about some of the new changes, I want to say again that if now or later you or your team could benefit from some specific training in our portals on how to practically administer COBRA and report changes, our team will be happy to help you. If you need some compliance training on what COBRA is, what you need to know, make sure all benefits that you sponsor that are COBRA eligible are being handled by you, by us, by someone for COBRA. We have all kinds of training options, live, recorded, and otherwise. We'll be happy to assist you with. So we're going to shift now from a refresher on the basics and the key issues of COBRA, what it is, who it applies to, what benefits apply, how long it lasts, to where we are right now, which is in the pandemic period and dealing with some specific legal changes that are new for all of us, and we're handling for your plan that we're administering. Laura?
Thanks, Jason. In response to issues that have arisen affecting both employees and COBRA participants and employers, the Department of Labor and IRS recently issued a final rule that provides relief for a couple of employee benefits related items, including COBRA relief due to the COVID-19 national emergency. And if you were with us during our last webinar, Jason mentioned that this guidance and some of the other guidance that has come down as related to COVID-19 issues is tricky. It's tricky because it's retroactive, and at least this and some of the other guidance is temporary. So some of you may remember back in our ACA days, the changes, while they seem to come in a flurry, and I joke that they always seem to come either on a Friday afternoon or right before a holiday weekend. While there was a flurry of guidance that came in a short amount of time, employers usually had time to digest, plan, and implement on a go-forward basis. That's not the case with this guidance. As I mentioned, it is retroactive, and it extends through a yet-to-be-determined outbreak period. So not only do we have to go back, we're not quite sure at this point how far forward we have to go. But the COVID-19 relief for COBRA does provide some extensions for specific COBRA deadlines. It applies to plan notices, deadlines for responses by qualified beneficiaries, and premium payments. And as I mentioned, the term that is used for this relief is the outbreak period, and that is a specifically defined term in the final rule that is defined as March 1st of 2020 until 60 days after the yet-to-be-determined announced end of the COVID-19 national emergency, or an end date announced by the agencies not to extend beyond March 1st of next year. So the deadlines that are extended are plan deadlines and also qualified beneficiary deadlines. The deadline that applies to the plan is that the deadline to furnish the COBRA elections notice is extended. This is the specific rights notice that Jason has referred to previously. I do want to note that ProBenefits will continue to send required notices based on standard COBRA deadlines. So if we are administering COBRA for your plan, as soon as we receive notice that there is a qualifying event, we will be sending that specific right notice based on standard COBRA deadlines, not on the extended deadline. There are also deadlines for qualified beneficiaries to do certain actions that are delayed. These are generally the obligation to notify the plan of a triggering event. So that would be, for instance, a divorce. The deadline for a qualified beneficiary to notify the employer of a divorce or a second qualifying event. The deadline to notify the plan of a disability determination. The deadline to submit an election to the plan, so to actually make a COBRA election, and the deadlines for making the initial payment or subsequent premium payments are also extended. So going back to our COBRA timeline, just to give you a visual, the notices on the left, or the deadlines on the left that are in red, are the parts of this COBRA timeline, the standard COBRA timeline, that are impacted or extended by this relief. So we've got the specific rights notice. There is an extension to provide that, although we are going to continue to abide by the COBRA rules with respect to sending that notice. There is an extension to elect COBRA, and then extensions on the premium payment. So we're going to walk through some examples of this just to give you an illustration of how this will work. But I want to talk first generally about the administrative adjustments that we have made at ProBenefits that you will be seeing. So for standard scenarios, this really will not be affected by deadlines. These are the standard scenarios where the qualified beneficiaries operating the existing rules, they are electing timely, they are paying their first premium timely. Under the standard rules, they're paying their subsequent premium payment timely. Those folks are going to keep trucking along in their COBRA coverage. Nothing is really going to feel very different from the employer's perspective or the qualified beneficiary's perspective in a standard scenario. We are going to be sending a supplemental notice. This notice was actually included in the email compliance alert that we sent out yesterday. It is also listed in your dashboard for the webinar under handouts, so you can take a look at that. This supplemental notice is going to go with all general rights notices that go out, the specific right notices, or the election notice, the notices about premium payments being due, the coupon booklet that goes out, and the termination notice if someone has their coverage terminated early due to non-payment. So this supplemental notice provides information about these COVID extensions and reliefs for COBRA coverage. We are also going to be sending this notice in a letter to qualified beneficiaries who had COBRA coverage terminated early due to non-payment from March 1st of this year to the present. So they will receive that, informing them of the ability to of this relief under the COVID extension. And these, the supplemental notice does provide some information that may be helpful to you as a plan, but it can also be used if you have employees that have any questions about the COVID relief. So you will start to see those going out today. Those general rights notices that go out today, election notices that go out today will contain this supplemental information as part of this. So the examples, the final rule, if you have read them, include some examples illustrating how this relief works. And I'm going to walk through some similar examples that are in the final rule and include our administrative adjustments to comply with these temporary changes. For clarity, the final rule assume an end to the COVID period. I'm also going to assume an end to the COVID period for purposes of our webinar today. We're going to assume that the COVID-19 national emergency ends on June 30th, which would be wonderful news for us all. It is also my son's birthday, so that would be a great birthday gift. But so if the national emergency ends on June 30th, the outbreak period will end August 29th of 2020. Remember, the outbreak period is the 60th day after the end of the national emergency. So in our first example, we're going to look at how the COVID relief impacts the election of COBRA. So here we have Joe, who is a covered participant. Joe experiences a qualifying event of reduction of hours. He is timely provided with an election notice on April 15th of 2020. So under the standard rules, Joe would have 60 days from April 15th to elect COBRA. But with the COVID relief and COVID extension, the last day for Joe to elect COBRA is now 60 days after the outbreak period. Again, the outbreak period ends August 28th, 2020. So Joe has until October 28th of 2020, which is 60 days after the end of the outbreak period, to elect COBRA. So our system, the way that we will be complying with this temporary change is that the election period will be extended in our system so that in Joe's example, if Joe were to elect on October 1st, he would be able to be processed in the system. Now, I'm speaking to these examples based on our administrative updates to comply. If we are administering COBRA for you, this is how our process will work. If you are using someone else for COBRA or working with another vendor, or you're perhaps administering it yourself, these administrative changes may vary depending on your specific situation. So example 2, we're going to look at the initial COBRA premium. Remember, once a qualified beneficiary elects COBRA, they generally have 45 days to make that initial premium payment. So here we have Joe. He is a covered participant, experiences a qualifying event, reduction of hours. He's timely provided with his election notice, April 15th, 2020, and he elects COBRA on April 20th, 2020. So what is the impact of his deadline for the initial premium payment? Under, as I mentioned, under the standard rules, it would be 45 days, but under the COVID relief, that deadline is extended to 45 days after the end of the outbreak period. And for our example today, that outbreak period ends August 29th, 2020. So in this example, Joe has until October 13th of 2020 to make his initial premium payment. Now, this example, Joe could make his premium payment timely, and he would sort of fall under the standard scenario, operating outside of the extension. But if he makes his payment anytime between April 20th and October 13th, he will have his coverage reinstated. Now, if there are multiple payments that are due for Joe, he will have to make those multiple payments. You'll see that in our next example, in order for his coverage to be for multiple months. But in our system, the initial premium payment period will be extended to comply with this change. So both for the election notice and the initial premium payment period extension, there is nothing that you need to do on your end. We are making those changes system-based. Okay, example 3. This is the example of someone who's actually on COBRA already, and they have ongoing premium payments due. And we're going to use Jane here. Jane is a COBRA participant on April 1st. So she had a qualifying event. She elected COBRA. She made her initial payment and has made a timely premium payment for April, but due to the COVID outbreak, perhaps she has experienced some financial hardships and is unable to make any subsequent payments during the outbreak period. The COVID-19 extension relief is that the deadline to make the ongoing premium payment is 30 days after the outbreak period, again, August 29th, 2020. And in Jane's example, she would have until September 28th, 2020 to make up those missed payments. So from an administrative perspective, Jane is going to receive from ProBenefits a termination of coverage notice due to non-payment. This is a manner that will provide protection to the plan from having to perhaps front premiums to the carrier, and also doesn't make the assumption that Jane actually wants to continue her coverage, but gives her the ability to do so if that is her intent. The termination of coverage notice is going to include the supplemental notice with information about the COVID-19 extension. That notice, as you will see, also contains information for Jane to contact ProBenefits if she has questions about what deadlines apply to her or how much money she owes in order to reinstate her coverage. So in this example, her coverage is going to terminate, but at the end of the outbreak period, Jane is going to have 30 days to make missed payments and have her coverage reinstated. So if she makes those payments on or before that extended deadline, then her coverage will be reinstated. If Jane only makes timely payments for May and June, remember my example, Jane had paid for April but stopped paying afterwards. If she, at some point during the outbreak period, makes the payment for May and June, she will only have coverage reinstated for May and June. If she wants coverage reinstated for the remainder of her COBRA coverage period, whether it's 18 months or 36 months, here Jane is our employee, and so it would be generally 18 months. She's going to have to make up all of those payments that are missed. So whatever that period of time is, remember those COBRA duration deadlines are not extended, but she would have to make up any remaining payments in order to have full COBRA coverage through the end of her COBRA period. And one of the things we are encouraging COBRA participants to do, you'll see this in the handout of the supplemental notice, is if they can, financial hardship, if they don't make the payment, of having 30 days at the end of the outbreak period to make multiple months worth of COBRA payments. We know that COBRA generally is expensive. It is perhaps compounded if you're having to pay for multiple months all at once. And also ensuring that there's no retroactive reinstatement. So if Jane is going to see providers, she would probably want to make sure that she has that coverage in place so that the claims can be timely processed versus having to wait to the end of the outbreak period, make up the missed payments, and then have the coverage retroactively reinstated. So as a general rule, we're trying to encourage our folks to continue to pay on a timely basis to avoid any hardships that may come at the end of this outbreak period. So COBRA, I think that helps. Many folks prior to this may have had that thought help, but even after these COVID extensions, that may even be more so the case. COBRA has always been complicated. It is now so even more complicated because of these extensions and this relief that is temporary but retroactive, and temporary, but we don't know how temporary. We don't have an end date yet for determining when this relief will end. It's time consuming, it involves risk. One of the cases, if you monitor employee benefits lawsuits, COBRA is quite frequently at the center of many of those lawsuits where a plan has not met their COBRA obligations. Please know that we are here to help not only with COBRA as it is from a standard basis, but also to help you understand these extensions and this temporary relief. Outsourcing saves time and money, but it also provides a communication and compliance buffer. That has always been the case, but it is even more so now. I think we're going to see lots of questions from COBRA participants about this relief, what it means, how it applies to them, especially since there are so many people that have experienced financial hardship during this pandemic time. And as Jason mentioned, we do have training options and compliance assistance available if you need additional information at any time. We are always here to help you with that.
Guys, to everyone, thank you for joining us today. Laura, thank you for your time and expertise. What we're going to do now is end the presentation portion of our session. If you have submitted written questions to the question box that we have not yet answered, we'll take care of those here in the next few minutes. Again, questions are also welcome to the email address compliance@probenefits.com, which is always a direct line to our team of 4 legal professionals working in addition to our administrative, tech, and other teams in order to serve employers of all sizes and different places. Thank you for your time today. Hope it has been helpful. We welcome your questions and your feedback, and appreciate the opportunity to work with you and take care of these matters on behalf of participants everywhere. Take care, have a great day, and we'll talk to you soon.
Muted.